What is BPH and why is it causing your symptoms? It's a walnut-sized gland that surrounds the urethra. The urethra is the tube that carries urine from the bladder. And as men age, the prostate can enlarge. This is called benign prostatic hyperplasia. The enlarged prostate squeezes the urethra, making it harder to urinate. And patients may have symptoms like a weak or interrupted stream, straining, using their belly to try to help urinate. They have a feeling of incomplete emptying, frequent urination, especially at night, urgency, and dribbling, and sometimes the inability to urinate at all, which is called urinary retention. So, what is prostate artery embolization? This is a minimally invasive procedure. It's image guided. It's performed by our colleague, the interventional radiologist. Once the catheter is at the blood vessels for the prostate, microscopic particles, which are about the size of grains of sand, are injected into these arteries and really reduces the blood flow to the prostate. Without the blood supply, the prostate gradually shrinks, and that relieves pressure on the urethra. The patient's under conscious sedation, which means you're relaxed but awake. What is the evidence for PAE? Well, there's a lot of evidence out there supporting PAE. Produced a 13-point improvement in the IPSS score, which is a very dramatic improvement. 94% of patients who had a catheter coming in were catheter-free at 3 months, and most patients were off their BPH medications at 1 year. What are the benefits then of PAE? Well, there's a significant improvement in symptoms. Most studies, again, show IPSS scores dropping dramatically. There's quality of life improvement by 60 to 65%. It's outpatient, you go home the same day. Normal activities usually within 1 to 2 weeks. There's no incision, there's no catheter, there's no urinary bleeding. Most patients are able to stop their BPH medications. Risks and side effects of PAE. There's post-embolization syndrome, which is really not a complication as expected. This is usually managed with over-the-counter medications and is temporary. Who makes a good candidate for PAE? Patients who have moderate to severe BPH symptoms, patients with large prostates, especially greater than 60 grams, patients who want to preserve sexual function. If you're in urinary retention, you may be a good candidate for PAE. Who's not a good candidate? If you have tortuous anatomy, if you have prostate cancer, PAE is not a treatment for prostate cancer. So at this point, if PAE sounds like an attractive option for you, we'll make sure that your history is adequate and suitable for PAE, and also have you talk to the radiologist to get a better understanding of the procedure itself. Afterwards, we will, at the urology place, continue to follow you and make sure you continue to do well. Thank you for your time.